Good afternoon, everyone. Good afternoon, everyone. I'm Dr. Rajeev Singh, working as a diabetic food consultant at Yasal Raheja and Fortis Associate Hospital, Mahim. I'm working here since 4 years. I've done my specialization in diabetic foot and ankle surgery. What is diabetes? Diabetes is a disease in which blood sugar increase, which is insufficient of insulin or excess of in, uh, insufficient of insulin or less production of insulin in body, which lead to the diabetes. Why diabetes? Which can affect any organ like heart, brain, eyes, feet, nervous system, due to which diabetes, uh, about 2 lakhs people lose their leg every year in India. We have 74 million people suffering from diabetes. So we have 148 million people who has diabetic foot problem. Every year 2 million people lose foot due to diabetic amputation, which is out of that 85% is due to diabetic foot neuropathy, which is preventable. If we compare, see the mortality rate, out of which fifth number after carcinoma of prostate, diabetic foot lead to the mortality in the India. Prevention is better than cure. When we see, what is prevention? How can we prevent our patient leading to the diabetic and fit, which lead to the gangrene and amputation? Patient presented us with the tingling, numbness, heaviness, or burning in soul, or something. तो पेशेंट को पता ही नहीं होता है कि क्या करने का है. That are early signs and symptoms of diabetic feet. So we have well equipped department whether we can early diagnose the patient is going to develop a diabetic foot problem, which is early symptoms like doing the podiatric scan. We can pressure monitor the pressure, foot pressure. According to that, we can customize the shoes and sandal and give and prevent the patient landing to the amputation. We have seen many people presenting to us which went to the parlor for manicure pedicure, which lead to the gangrene of the toe without knowing the blood flow. Went for the nail cutting, which lead to the gangrene of the toe. A patient land up in the amputation of the great toe. We have seen many people wearing the pointed shoes, tight shoes. That is not advisable for the diabetic patient. We have seen many people wearing sleepers, Hawaii sleepers, which is also not recommended for the diabetic patient. This all major cause of the amputation and which is due to diabetic neuropathy, which is preventable. How it can be prevented? By doing yearly checkup of the diabetic food team or diabetologist. How it can be early picked up? It can pick up. We have seen many people to present with the callus corn in the feet, which is due to the diabetic neuropathy, due to restricted mobility of joint, which lead to the callus, which lead to the ulcer lead to the gangrene, where patient land up the amputation. So how we can prevent it? We can prevent it by proper checkup of the foot, by neuropathy examination, foot scanning, proper advisable footwear, which we all have in our at Yasal Raheja Hospital. At present, in this COVID situation, we have separate department, separate OPD for the non-COVID patient. We have separate floor where we admit the non-COVID, and we have separate OTs for our non-COVID patient where we operate them. We have well-equipped department which consists of diabetologist, nephrologist, cardiologist, neurophysician, vascular surgeon, orthopedician, we have well trained dressers and nursing staff will help in to counsel you and how to do the dressing at home and how to take precaution at that your feet. We have also seen many people without knowingly travel in the bus, train, or anywhere with the barefoot, which lead to the blisters in the foot, which lead to the again gangrene and amputation. So I like to tell or few points which diabetic patient has to take the prevent the amputation. Never walk barefoot. Never go for pedicure, manicure. Always avoid hot and cold fermentation. Always take the proper shoes. Never walk bare foot in the temple or anywhere inside your house also. Or without doctor prescription. Never go for any footwear whether it is branded with the diabetic sandal. At last, I want to close this talk. The foot is the biomechanism too, which can be preventable by regular checkup. So I request everyone who have any query about the diabetic foot, they can visit us at SL Raheja Hospital or they can consult at our website. At last, I would like to thanks to everyone and happy Diwali in advance to everyone.